Hey guys, so we just left off in lecture talking about diabetic ulcers. We talked about pressure ulcers earlier, but we use the Wagner ulcer grade classification scale, again, specifically for diabetic ulcers or pressure ulcers. So the grading scale on this one is a 0 through 5 scale, so this is a bit different than the scale that we used for pressure ulcers. So a grade 0 would be no open lesion, but can have pre-ulcerative lesions, healed ulcers, or presence of bony deformity. A lot of times with diabetic neuropathy, especially in the feet, we start to see things looking a little bit differently. We do start to see some more deformities in the feet. I actually had a patient whose arches were so collapsed once that her footwear had to be specially made for her, and they looked quite different. So we start to see some deformities. A grade 1 would be a superficial ulcer. It does not involve any subcutaneous tissue, so this would only be through the skin. A grade 2 is a deep ulcer that does go down through the subcutaneous tissue. It can expose bone, tendon, ligament, or joint capsule. A grade 3 is a deep ulcer with osteitis. Osteitis is inflammation of the bone itself. An abscess is a confined pocket of pus that collects in tissues, organs, or spaces inside the body. Or osteomyelitis, which is inflammation of the bone caused by infection, which usually happens in the legs, arm, or spine. A grade 4 would include gangrene of the digit, which again is typically non-viable tissue, needs to be removed. And if it can't be treated, then it could be a grade 5, which is gangrene of the foot that could require a disarticulation. A disarticulation is a specific type of amputation. With a disarticulation, the entire foot is removed. The tibia and fibula are pretty much left intact, although they will usually remove the malleoli just to make it level on the bottom, so then the person can be fitted with a prosthetic foot. This specific type of amputation is sometimes referred to as a SYMES amputation. That's SYME''S. You guys will talk a little bit more about that in procedures, but we do tend to see this type of amputation a little bit more with our diabetic population. It's not necessary to always remove the entire foot. It is common that they can remove toes or digits and partial foot amputations as well. All right. So some other miscellaneous types of wound. These wounds that we're referring to are going to be anything that's not a pressure ulcer or a diabetic ulcer. So a superficial wound is trauma to the skin where the epidermis still remains intact, like a non-blistering sunburn. A partial thickness wound extends through the epidermis, possibly into the dermis. This could be abrasions, blisters, skin tears, lacerations, cuts. A full thickness wound extends through the dermis into the deeper structures, like the subcutaneous fat. And these are typically wounds that are deeper than 4 millimeters and allowed to heal by secondary intention, which, remember from back towards the beginning of the term we talked about, is when it's not superficially closed. So the wound is intentionally left open in order to heal. A subcutaneous wound extends through the skin and deeper structures, such as the subcutaneous fat, muscle, tendon, or bone, and these do typically require healing by secondary intention, meaning they're left open to heal on their own, do typically or sometimes refer surgical management as well. And then finally, the red, yellow, black system to classify wounds. These are typically the colors that we see in the wound. So red is typically referring to pink granulation tissue. This is healthy tissue. This is viable tissue. This is what we want to see in a wound. So our goals here would be to protect the wound, keep it covered, and help to maintain a moist environment. Yellow is usually moist yellow slough. We need to remove the exudate and debris. We need to remove all that slough from the wound. We want to use wound dressings that are going to help to absorb some of that drainage to try to dry the wound out a little bit. And then a black wound would be thick black eschar that's usually, again, firmly adhered to the structures underneath. That needs debridement. We need to try to remove that black tissue so that the wound can heal. And there are the references, and that is it. Sorry to run over a little bit, and sorry to have to make you guys watch this, but Hopefully this will be all you need then for the midterm coming up on Friday. Thanks.